Do you have overactive bladder? What if you've tried behavioral therapies like diet changes or pelvic floor exercises without improvement? What if you've taken an overactive bladder medication? What if you've taken several overactive bladder medications? Today, I want to talk about one of the so-called advanced therapies or third-line therapies for overactive bladder, peripheral tibial nerve stimulation, or PTNS. Learn about another treatment to help your overactive bladder at the OAB clinic. So, therapy for overactive bladder, often abbreviated OAB, typically begins with what we call first-line therapies or behavioral therapies. These are therapies that can be done on your own and present little or no risk. Behavioral therapies include diet changes, bladder training, and pelvic floor exercises. These are discussed in detail on the OAB Clinic website, as well as on our other videos on this channel. Medications are often added to behavioral therapies, either in the beginning if your symptoms are really bothersome, or later on if you aren't seeing any improvement. But maybe you don't see satisfactory improvement with either behavioral therapies or medications. If so, you may have refractory overactive bladder. Now, we usually wait about 4 to 8 weeks before deciding that a medication is not going to provide you with enough improvement, though that time can be shorter if bothersome side effects force you to stop the medication early. OAB is considered refractory even if only one medication was used. However, with 2 different classes of overactive bladder medications available, most experts would recommend a trial of more than one medication before concluding that a patient has refractory overactive bladder. If you have refractory OAB, you may want to consider a third-line therapy for your symptoms. Third-line therapies are not used earlier because they tend to be a little more invasive or more expensive than medications or behavioral therapy. They also carry higher risks than those therapies that are used earlier, but they can also help with symptoms even when earlier treatments have failed. PTNS is one of the advanced or third-line therapies for refractory OAB. Peripheral tibial nerve stimulation and percutaneous tibial neuromodulation are just 2 names for the same therapy. In this therapy, a branch of the nerve to the bladder is stimulated near your ankle. A very small needle is placed underneath the skin and a very low electrical current signals the nerve. The treatment occurs in a doctor's office and lasts about 30 minutes per session. The sessions have to be repeated to achieve an effect and then maintain that improvement with bladder symptoms. An important advantage of PTNS is that it is minimally invasive, so that it can be used in patients who might be at risk from other OAB therapies. The biggest drawback to PTNS is that, right now at least, you have to come into the office to have it done. Now, there are devices in development which would allow PTNS to be implanted and you wouldn't have to come to the office anymore. But right now, those are still in development. What can you expect if you're having PTNS therapy? Well, the process is actually pretty straightforward. You come into the office and sit comfortably in a room, usually with one of your legs slightly elevated to make it easier to access the part of your leg where we'll stimulate the nerve. The treatment area is just above and beyond the bone that you can feel on the inside of your ankle. We then clean the site with an alcohol wipe to prevent infection. Then, a small needle is inserted a few centimeters underneath the skin. The needle is very thin and is usually not uncomfortable. In fact, some patients don't even feel the needle going in at all. Next, a very low electrical pulse stimulates the tibial nerve. The tibial nerve is a branch of the nerves that also connect to your bladder. The stimulation is usually felt as a tingling in your foot, and there may even be some movement of your toes. The treatment lasts for about 30 minutes. After this, the needle is removed and you are able to return to normal activity immediately. There is no need for anesthesia and there are no restrictions on driving or eating before or after the procedure. Peripheral tibial nerve stimulation therapy is usually divided into 2 phases, the induction phase and the maintenance phase. You begin with induction treatment consisting of 12 weekly sessions. Most people begin to see improvement by session 6, but the full 12 sessions can be necessary for you to see satisfactory improvement. If the 12 induction treatments have been successful in controlling your symptoms, treatment then moves on to a maintenance phase, which is less frequent. Maintenance treatments are typically every 3 or 4 weeks, though some patients are able to space them out even more. The maintenance treatments have to be maintained if you want to continue to see the positive effects on your bladder symptoms. I think that the main advantage of PTNS is that the risks and side effects are minimal. Some patients experience discomfort at the stimulation site, but that can usually be fixed by turning down the stimulation setting or moving the needle. I very rarely see discomfort keep patients from actually completing their treatments. There can be some slight bleeding at the insertion site, but the needle that's used is so small that any bleeding quickly stops without anything needing to be done. One important note is that if you have a pacemaker or a defibrillator, PTNS therapy is not appropriate for you because there are concerns that this type of stimulation could interfere or trigger a cardiac device. Unfortunately, the biggest obstacle to PTNS therapy is the need for office visits to receive the therapy. After completion of the 12-week induction phase, which can be a burden for some patients, the average patient will need to repeat them every 4 weeks. For people who do not live near a provider who is experienced with PTNS, this can limit their access to therapy. How well does PTNS therapy work? Well, numerous studies have looked at the effectiveness of peripheral tibial nerve stimulation, and they indicate that about 70% of patients respond to the therapy. Now, it's helpful to note that many OAB studies define success as 50% improvement in symptoms. This means that someone who urinates 20 times a day would have to see a decrease to 10 times or less to be considered a responder. Someone who averages 4 incontinence episodes per day would be considered successful if they saw only 2 episodes of incontinence with treatment. Some, but not all patients, continue to see the same improvement in symptoms over long periods of time, with some studies showing benefit up to 3 years. PTNS has been compared with medications for control of bladder symptoms and found to be similarly effective. An advantage of PTNS over medications is that there are fewer side effects. As you can see, peripheral tibial nerve stimulation, also called percutaneous tibial neuromodulation, can be an effective therapy for those who have refractory overactive bladder. It is minimally invasive with low risks and few side effects, and it may be an ideal therapy for those who would not tolerate other advanced therapies for overactive bladder. It can be somewhat inconvenient, particularly if you don't live close to a provider who's experienced in the therapy, though new technology may solve this problem in the future. If you enjoy this topic, please like and subscribe this channel for more information about bladder and pelvic health, or join a more in-depth discussion at the OAB Clinic website at oabclinic.com, where you can learn more about how to find your better bladder.